Hello, my name is Dr. Farman Ali and I am a GP family physician. Today we will be talking about a very common problem called acute tonsillitis. So what is tonsillitis? Tonsils are basically made of soft gland tissue and they are a part of your body defense mechanism. They make a part of your immune system, as we call it. Every person has got two tonsils, one on either side at the back of the mouth. Infections of these glands can occur and it can be either viral or bacterial, and this is known as tonsillitis. The infection may spread by close physical contact with other people or by droplets in the air caused by sneezing or coughing. So what are the signs and symptoms of acute tonsillitis? A sore throat is the most common of all tonsillitis symptoms. You may have cough, high temperature, headache, feeling sick, feeling generally tired, finding swallowing very painful, and swollen neck glands. The tonsils may swell and become red. Pus may appear like white spots on the tonsils. The symptoms typically get worse over 2 to 3 days and then gradually go away, usually within a week. So what are the red flag signs that you need to be aware of? You need to seek urgent medical attention if there is difficulty in breathing, difficulty in swallowing your own saliva, difficulty in opening your mouth, severe pain that is not relieved by common painkillers, a persistent high temperature that is not responding to paracetamol or ibuprofen, a severe illness, especially when the symptoms are mainly on one side of the throat. The treatment for tonsillitis. First, we talk about the general measures. One option is to do nothing, and very mild infections usually resolve by themselves. Hydration is very important. Due to the high fever, you may be lacking fluids in your body, which can make headaches and tiredness worse. So it's important to keep yourself very well hydrated. Paracetamol 4 times a day. This is used as a first line in children. Common forms that it is available in the market is Calpol. Ibuprofen, it has shown to have better results. It is given 3 times a day according to the recommended doses. Other measures that you can do is gargles, lozenges, a spray that is known as Difflam spray is available over the counter from pharmacies. This helps to soothe the sore throat. However, these measures do not shorten the illness. The main question is, do I need antibiotics? Most sore throats and tonsil infections are caused by viruses, and antibiotics would not have any effect on them. Even if it is caused by bacteria, an antibiotic does not make much of a difference in most cases. Your body defense mechanism is strong enough and it usually overcomes these infections. However, in certain circumstances, antibiotics may have a role. These are if the infection is severe, if it is not easing after a few days, or if you have a weaker immune system, such as those people who have their spleen removed, or if you are taking chemotherapy. One of the most common criteria that the clinicians use is called center criteria. There are 4 elements to this criteria. History of temperature, fever, tonsillitis, tonsillar exudate, which is pus on the back of the tonsils. Number 3, if there is absence of cough. Remember, no cough. Number 4, tender anterior cervical lymphadenopathy. In common words, if the lymph nodes are enlarged. Patients with one or none of these criteria are unlikely to have bacterial infections and hence do not require antibiotics. Patients with 3 or more of the central criteria require antibiotics. Now, what type of antibiotics are given? The choice of antibiotics most commonly used is phenoxymethyl penicillin, which is given as a 5 to 10 days course. People who are allergic to penicillin can be prescribed clarithromycin or erythromycin according to the recommended dosage for 5 to 10 days course. In certain conditions, you may require hospital admission, and this is indicated if there is breathing difficulty, if there is clinical dehydration, if there is a peritonsillar abscess, also known as quinsy, which I will come and explain a bit later. Signs of marked systemic illness or sepsis. There is a rare cause such as Kawasaki or diphtheria. If those are present, you may require hospital admission. One of the most common questions that parents ask, does my child need tonsillectomy, which is removing the tonsils altogether? There are guidelines which guide us in deciding whether the patient needs a tonsillectomy or not. The guidelines suggest that if child or patient had 7 or more episodes of tonsillitis in the preceding year, or if they have 5 or more such episodes in the preceding 2 years, or if they have 3 or more such episodes in the preceding 3 years, and these bouts of tonsillitis affect normal functioning. For example, children have to take time off school or adults have to take time off work. Then tonsillectomy may be considered by the ear, nose and throat specialist. I wanted to talk about quinsy, which is a peritonsillar abscess. Quinsy is an uncommon condition where a collection of pus, also known as abscess, develops next to the tonsil. This is caused by bacterial infection. It usually develops just on one side. It may follow tonsillitis or develop without tonsillitis. The tonsil on the affected side appears swollen or sometimes may look normal, but is pushed towards the middle by the abscess next to the tonsil. Remember, quinsy is very painful and can make you feel very unwell. It is treated with antibiotics, but also the pus needs to be drained by a small operation which is done by the ear, nose and throat specialists. So if you are suspecting quinsy, please refer your patient to the hospital. Thank you very much.